Good afternoon. Welcome to TLC Academy. I'm Alan Sousie, the Director of Nursing here at TLC Home Care. Today's topic I want to share with you is difficult situations in care management and ways to handle them. We've all been in situations that are difficult at times, and the loss and the best way to handle them confronts us. This can happen in home care as well. We do not always have the luxury of being able to call out to someone and ask questions or get help when we need it most, because we're not in a company office for all of the encounters that we have. So you do your best to muddle through it, and then you talk about it later. I'd like to go through a few common scenarios and give suggestions on how to handle those. The first one is, what happens if a client wants to give you a gift? Well, we're allowed, as employees of TLC, to accept gifts from clients and their families within reason. But all gifts, large or small, need to be reported or some type of notification given to your immediate supervisor. Your acceptance of the gift will be noted in your employee file, and if you do not want to accept a gift, it's perfectly okay to say accepting gifts is against our company policy. Double check what our company policy is, however, before you make that conclusion. The second type of situation you might find yourself in is a client wants to give you a hug. Hugs do not make all people happy, even though they feel good for most of us. So you do want to keep hugging to a minimum when you're giving care. It's okay to be honest and to say something like, I only give hugs to my family members. Or, I'm really not very comfortable with a hug. Most of the time the clients will accept that. They might question you a little further about it, and you can use your own discretion as to how to answer. A third situation, which is a little bit more significant, is the client makes some sexually explicit comments to you. It is okay to say, when those happen, please, that kind of talk is not appropriate, or it's really not okay to talk to me like that. I would prefer if you didn't. If this continues, you can say something like, I'm not comfortable with this conversation. If you continue, I will need to leave. If it does continue, it's okay to leave and to notify the supervisor that you had to and why. Another situation that couples with the sexually explicit comments is sexual touching, inappropriate touching. Certainly, if this happens, you immediately tell them to stop. And you might say something like, it's not okay to touch me in that way. Please, it makes me very uncomfortable. Or you might say, this is not okay. I do not want to be touched in that manner. It is okay to leave if the behavior continues. You can tell the client that you will leave if it continues. And then you notify your supervisor in any event. If this behavior does recur, you absolutely must notify your supervisor again about it. For both of the above scenarios, maintain consistent, firm boundaries. Do not accidentally encourage inappropriate behavior by sending mixed messages, like briefly allowing the behavior one time and then reacting negatively the next time. Be consistent, firm, and strong-minded every time, saying clearly, no, stop, I do not like that, or stop, that is not right for you to do. If the behaviors persist, it may mean it is time for your supervisor to pay the client a visit and discuss this matter. Sometimes family may need to be involved in these discussions, and there's always someone higher up to pass this off to. You do not have to handle these things alone by yourself. Another situation you might find yourself in is while you're house cleaning, you discover an unhealthy condition, or perhaps an insect or rodent infestation. These should be reported directly to your supervisor. Another situation is that the client becomes behaviorally or verbally abusive and aggressive. Again, you do not have to tolerate this if you cannot redirect the client verbally, or you cannot let this pass, and by ignoring it, the behavior stops. Then it is important for you to call and reach out for someone to assist you in handling the situation. No one has to be submitted to or subject themselves to any kind of aggressive or abusive behavior. Another situation, the client suddenly collapses in your presence. Typically, you're going to analyze for yourself several things. Is this person still breathing? Is their heart rate still moving? If they are not, then you will go ahead and proceed with emergency procedures as defined in TLC's policies. You will probably end up calling the emergency technicians by 911 and perhaps even doing CPR if it's necessary. On the other hand, if the client just falls and has an accident as a fall, you will also follow protocol there. Sometimes the client's able to get up on his or her own. You have to do nothing. You cannot put your hands on this person. But you may be able to verbally cue them on how to get up, and then you can then you can assess them to the best of your ability and your practice level. And if there's any kind of problem that you discover, you need to immediately report that to your supervisor. If the person is unharmed and it was able to get up successfully without you having to call the emergency technicians to help you, you still have to report it even if the person is unharmed. Two more points that I want to make. A client's family member requests that you provide him or her with their phone number or your email. This is an absolute no. Do not do this. It sets up the situation of familiarity and breaks professional boundary. And last, a client family member asks you to complete a care task that you know is out of your scope of practice. Again, it's okay to firmly state, I am not permitted to do this, and put the responsibility back upon the company, and you can frame it, I am not permitted to do this according to policy or procedural process of TLC. If the client disagrees and becomes concerned about that, you can refer them to contact the case manager or the director of nursing. So it's very important that you know what is in your scope of practice. You must know what is allowed and what is not. There can be times that the client or family member will ask you to do something you do not and should not be doing. An example is asking you to complete a blood sugar, glucometer measurements, or to even administer insulin. Asking you to move and clean behind a refrigerator is another example. You need to say, I am not allowed to do that, but, Susie, the other caregiver always does it for me, the client might say. Well, again, you repeat, I'm sorry, but I am not allowed to do that. I will call my supervisor right now for clarification. Remember to be firm, but polite and respectful in these kinds of situations. A good general rule of thumb to follow is to do what your gut tells you is right. But never forget that you may call TLC if you have any questions about anything. When you do, you will be provided information relative to the company policy and what the Nurse Practice Act states is within your scope of practice. In practice-related matters, a nurse supervisor or case manager is your best resource to resolve any concern. Calling the schedulers will not help you to resolve a problem relating to this matter of concern. Now, you may end up calling an on-call person to begin with who may be on duty on a weekend or after hours, business hours. But that on-call person, whomever it is, if it's nursing related, will direct you to a case manager or to the nurse on call. That is the procedure for getting in touch with support. And if you do call after regular business hours or on the weekend, call the central number, speak to the on-call person, and then they will do the rest of the work for you. There is always a nurse on call 24 hours a day, 7 days a week for any concerns. And if a situation makes you uncomfortable, you may ask to be removed from it. But remember, it might take up to 2 weeks for the changes to be made because scheduling needs to find a replacement for you. However, we will stop services immediately if it is a situation where you are not safe or you are being threatened. Inevitably, TLC wants to do what is best for staff and clients. And each situation, being different, is assessed in a unique way. In conclusion, we urge you to trust your own instincts, remain professional, and be confident that TLC has your back. And thanks again for participating in today's presentation at TLC Academy.